In this video, I'm going to demonstrate passive stretching or treatment-based stretching for the TFL, tension fasciae lata, and the quadratus lumborum area. You can focus more specifically onto the TFL area, but if we include a little bit of lateral flexion of the spine within the stretch, that will also help to open up that deep lower back QL muscle. Okay, so we would have completed these stretches after the client is warmed up. So we would have warmed the area up first to all of the muscles that we're going to stretch with some manual massage treatment first. So that way we are increasing the blood flow and increasing the temperature of the tissue. Okay, so first of all, because this is in treatment stretching, we also need to think about the towel positioning or the draping so that we're maintaining our client's dignity. We can see here that Lydia is still nicely covered with the towel. So we're going to stretch this leg. Okay, so we're aiming for the client to feel the stretch around those lateral fibers and possibly the anterior fibers of the TFL, so the tension fasciae lata, and also that deep QL muscle as well. So the first thing we're going to do is we're going to flex the opposing knee. And again, being mindful of maintaining their dignity, it's useful to tuck the towel into the underwear of the leg that you're flexing here. And we're going to cross the leg over. Then from here, we want to take the spine into that flexed position. We're asking the client to cross those arms over and making sure that they're not rotating from the pelvis here. So I'm just placing a stability hand on the front of the pelvis and then encouraging the client to flex to one side. So she's bringing the shoulder closest to me towards the side of the couch there. Okay, they'll take themselves over into a position where they might start to feel a slight stretch around that QL or deep lower back area. They might also feel it in the oblique muscles too. Then from here, I'm going to hook my hand just underneath Lydia's ankle. Okay, I'm going to support onto the opposite knee. And then from here, I'm going to draw her leg towards me, towards this side of the couch. Now I'm being mindful, I don't want the leg to rotate outwards as I bring it over, and I don't want it to rotate inwards either. We're not lifting the leg up off the couch, so we're not doing this. We're brushing the heel across the couch towards me. Okay, and then we're going to hold that position for about 15 to 20 seconds, making sure that the client can feel that stretch, okay, around that area. Obviously, if the client hasn't got as much flexibility and they've got a lot more muscle tension, you might not get the heel as far over as in this video today. Okay, so I'm just going to demonstrate that again. Ideally within treatment stretching and that passive stretching, we would aim to repeat this stretch twice. So we might do the stretch first on this side, then on the opposing leg, and then come back to this leg again. Okay, so our start position is in this supine position or face up position. We've just warmed up the areas that we're going to treat with some massage therapy. Okay, and then from here we're going to flex the knee, okay, making sure that the towel is still covering the client so that they feel comfortable. Okay, we're going to cross this over. Okay, we're going to ask the client to cross those arms. Okay, placing a supportive hand on the front of the pelvis here. We're going to laterally flex the client. Okay, and then from here, supportive hand onto the knee, hooking just underneath the ankle, and think about your body positioning, especially if you're stretching somebody who's a lot bigger than yourself. Okay, and then you're brushing that heel across the couch as you're feeling for that biting point, or you're feeling for the resistance in the muscle tissue. Okay, and then we're going to hold this for about 15 to 20 seconds. Or hold for longer, such as 30 seconds if time permits.